Hi, y'all. So, 5 medications most Black women should take during pregnancy. I'm Dr. Fatu Forna. I'm an OBGYN who works to keep pregnant women safe here in the US and around the world. So you have to make sure you talk to your doctor about any medication you take during pregnancy. Make sure it's safe because not all medications are safe during pregnancy, and there are certain medications you have to take to ensure that you have your best health during pregnancy. Especially for Black women, there are some critical medications that if you're not taking, you need to ask your doctor about. So what are some of these medications? Number one is prenatal vitamins. We all know about prenatal vitamins. We know that you need to be taking it. We know you need to start taking it before you get pregnant, because some of these vitamins and minerals, they need to be in your system when you get pregnant. For example, folic acid. It's one of those nutrients that helps prevent birth defects, spinal cord defects, and by the time you get pregnant, it's too late to take it. So you should have been taking it. If you're planning to get pregnant, make sure you're taking your prenatal vitamins. Prenatal vitamins have folic acid, they have iron, they have calcium, vitamins B, C, D, all of those things that you need when the baby is forming, to make sure that the baby forms right. And also as the baby grows, they need those to be drawing those nutrients from you to grow properly. So make sure you're taking your prenatal vitamin before you get pregnant, and you continue it throughout pregnancy and also in that year after you've had the baby. Folic acid, I talked about folic acid. You get it as part of your prenatal vitamin, but some women need extra folic acid. For example, women who have a history of a baby having some kind of spinal cord defect, they'll need to take extra folic acid. Women with sickle cell anemia, women who have multiple pregnancies, twins, triplets, you need extra folic acid. So make sure you talk to your doctor and ask about that. You can't take too much folic acid. You don't want to overdose yourself, so make sure you're talking to your doctor. Iron. Iron is critically important. Black women especially are twice as likely to be anemic in the US. So on top of that iron that you're taking from your prenatal vitamin, you probably need to be taking an extra iron tablet a day. And if you are anemic, your doctor will ask you to take more. So your doctor is going to check your iron level to see if you're anemic. They'll check that probably at the beginning of pregnancy, and also in your third trimester, and also when you show up in the hospital to have your baby. And if early in the pregnancy or in the middle they find that you're anemic, your doctor might tell you to take 1 iron tablet a day, or 1 twice a day, or even sometimes 1 3 times a day, depending on the level of your anemia. And of course, sometimes when you take iron, you get constipated. They might also tell you to take a stool softener called Colis. So ask your doctor about this. Now, this is critical because postpartum hemorrhage is one of the major causes of death for women around the world even. Anemia can also lead to preterm labor, preterm delivery, neonatal death, meaning the baby dying. So you need to make sure that your blood count is normal and that you're taking enough iron for that. That was what I just talked about was oral iron tablets. Now, another medication that's critically important for some women, especially some Black women, is IV iron, intravenous iron that they give to you through your veins. It's now standard of care that when we check your blood hemoglobin level and you are really anemic, your doctor will tell you that number, especially in the third trimester, there is not enough time to bring it up just by taking tablets. So if you're really anemic in that third trimester, a lot of times your doctor is going to prescribe an iron infusion, an intravenous iron infusion. And Black women, you need to ask about that. When you get that second blood iron level checked and they say you're really anemic, ask your doctor, do I need intravenous iron infusion? Should I be getting it through my IV because I might not be able to take enough through my mouth? Ask about that. It's critically important, and as we're learning more, we're realizing that more women need IV iron, and we're using it a lot more than we used to. And then number 5, baby aspirin. Baby aspirin is critically important for Black women. The American College of OBGYN, the United States Preventive Services, all of them recommend a baby aspirin for Black women. 1 baby aspirin every day, specifically for Black women, and also for women who are in other high-risk groups. Hypertension, if you have hypertension, diabetes, multiple pregnancy, obesity, and it's to prevent preeclampsia, sometimes also called pregnancy-induced hypertension. Preeclampsia, hypertensive conditions, that's the #1 killer of Black women in the U.S. And a major cause of morbidity or illness. For Black women, I want to be clear, it's not your race per se that makes you at high risk. It's the racism and all of the associated high-risk conditions that can happen, to Black women. That is why that decision was made, that Black women need to be on a baby aspirin a day during pregnancy, and that they start taking that daily from about 12 weeks of pregnancy to delivery. Ask your doctor again about baby aspirin. I've talked about all these medications. I'm not your personal doctor. I'm not treating you. I don't have all your medical information. So this is not medical advice per se. This is information that you need so that you're discussing this with your doctor, and you're asking your doctor, should I be taking a baby aspirin? Should I be getting IV iron? Is my hemoglobin and my blood count low enough that I need these things? So these medications are important. A lot of them can make a difference. It can be a life and death issue. I talk a lot about mortality, but I talk about how to prevent it, because we can prevent nearly all maternal deaths can be prevented if you have the information. So talk to your doctor. Make sure you're taking some of these meds if they apply to you during pregnancy, because Black women, we need you to survive and to thrive.